Well, welcome to this demo video of UniBanQ, our medical education all-in-one platform. So UniBanQ was developed around three main features: clinical cases and question banks for all levels of medical school, so medical studies, so what we call preclinical studies, and then clerkship, so your clinical rotations, your licensing exams, so the MCQE1, USMLE, and more, and also for residency. The other feature is the virtual case simulator, which allows you to practice for OSCEs by questioning patients and developing your differential diagnosis and clinical judgment. And the last feature being the study desk, which is a section that allows you to take any notes and generate content like podcasts, flashcards, cases, and even summaries for any document or YouTube video you have by talking about our cases and question bank. So as I said, you really have subscribed to UniBanQ to different. So what sets apart the different question banks is the explanations that are offered. So for the medical studies question bank, it's really focused on really basic science, pathophysiology, and really clinical pearls in terms of knowing how a pathology works. For clerkship, it's going to be focused around differential diagnosis, the expectations of your attending in terms of what you need to know as someone who's doing his clinical rotations for the first time. And for licensing exam, it's going to be based more around diagnosis, treatment, and also national guidelines, of course. And for residency, more around how to take care of patients, long-term follow-up, and other considerations, for example, regarding public health and regarding also legal aspects of medicine. So I won't go through every question bank, but basically, regardless of the question bank you go through, you're going to have pretty much two options. So you're going to have either the option to have an exam mode or a study mode. So the exam mode basically just lets you kind of simulate an exam. So you go through the whole set of questions, you have a time limit, and after the time limit, you have access to all of your feedback, whether you were right, wrong, and the explanations. When you go through the study mode, you basically have access to all the specialties that are relevant for different levels of medical school. So here I'm showing the section on licensing exams, but if we go back, for example, to clerkship, you're going to have different specialties like psychiatry, pediatrics, surgery, ER, etc., etc. So you can select all specialties or just one. You have the ability to filter through if the questions were unanswered, correct, or incorrect, and select the number of questions you have. So just for the purposes of this demo, I'll select about 20 questions. You can create the text. So the interface of UniBanQ was made to kind of really reflect how you learn about cases in medical school and how you interact with patients in clinical rotations. So most of the clinical cases are going to be based around real life. I wouldn't say real life, but around clinical case scenarios in the hospital. So you're going to see that the case stem is pretty much similar in terms of offering how a realistic scenario would look like. You have lab values that are in different units, of course, and you have the normal ranges on the right side. You also have imaging results if relevant for different questions. You can also go through questions. You have a timer up on the left-hand side as well as a highlighting section. You can choose the color and, of course, erase as well. You also have a study notes section where you can take notes. So let's just go through a question real quick. So when you submit an answer, you're going to see first of all, if it's right or wrong. And when it comes to the explanation, what really is different in UniBanQ from other question banks is that we really put a focus on having extensive explanations that cover a lot of different aspects of the medical training. So not only do you have an explanation of the answer, but you're also going to have a general management that is in order of priority. So what things need to be done to assure in terms of the most urgent to the less urgent need to be prioritized. You're also going to have explanations for all the other options, whether they're right or wrong. And as I said, depending on the type of question bank you're going to have, you have different sections. So example here in clerkship, we're going to have a section of clinical pearls, a section about patient reality as well. And as I said, for some questions, sections about, for example, the attending's expectations. So you have here the additional information, common pitfalls as well. And of course, pimping knowledge, because we all know we all get pimped in during rotations. For all question banks, you're going to have references. So references are either going to be national guidelines or sometimes just summary articles about some subjects if there are no guidelines for that. You also have YouTube videos that are relevant for different sections as well, and a section, of course, to offer feedback. So that's pretty much it. So feel free to go through all different question banks. Let us know what you think. Have a great day.